live from the Wood TV 8 studios.
Good evening and welcome to our program. We're pleased to bring you this important opportunity to answer some of the more than 3,000 questions that you submitted from all over the state. Tonight, we're particularly happy to have our two guests, Governor Gretchen Whitmer, whose team has worked with us to make this happen and let her interact with you at a time when face-to-face contact just isn't possible. We're all practicing social distancing, and you're going to be hearing a lot about that tonight. First, I want to go to you, Doctor, and tell people who you are, because you're a very important part of this show. From this standpoint, we're going to have a lot of medical questions, and we need somebody who knows this information. So please introduce yourself.
Yes, well, thank you so much. My name's Norm Beauchamp. I'm the Executive Vice President for Health Sciences at Michigan State University.
Well, thank you very much, and thank you both very much for being here. Now, I would like to welcome our viewers, not only here in West Michigan, but also watching on our sister station, WLNS in Lansing, WJMN in Marquette, our partners at WJRT in Flint, and Fox 33 in Cadillac, and ClickOnDetroit.com, making this a statewide broadcast and webcast. Of course, you can catch it all on woodtv.com as well. This town hall will be available virtually all over the state. And we welcome our deaf and hard of hearing communities who can watch this town hall interpreted live on the Wood TV Facebook page. The town hall with sign language interpretation on screen will re-air at 3 o'clock tomorrow afternoon on WOTV and woodtv.com. Portions will also be seen on my Sunday morning show, To the Point. Tonight, we will be utilizing any number of ways to get our viewers from around the state to connect with the governor and the doctor. I will tell you more about that in just a moment. But I wanted to begin by asking Governor Whitmer to take the stage and really set the stage for us and talk to you directly about where we are as a state less than 3 weeks into this health crisis. Governor?
Yeah, well, thank you, Rick. Thank you all for tuning in tonight. In just over 2 weeks, we have gone from 0 cases of COVID-19 to 2,856 in Michigan today. This virus is spreading exponentially. On Monday, I signed the Stay Home, Stay Safe executive order that directs non-critical businesses to close and directs all Michiganders to stay home. I want to be clear. You can go to the grocery store. You can go to the pharmacy to get your prescription filled. You can fill your car with gas, go outside and walk your dog, or go for a run. But I want everyone to be smart. Take care of yourselves and each other. Stay inside for the daughter who has asthma, the grandpa with COPD, the sister with MS, and for yourself, for your community. Stay home, stay safe, save lives. I'm really looking forward to answering your questions tonight.
Well, and we look forward to that as well. Now, quickly before we go north for our first question, 2 items of news today that came up, and you have asked now for a federal disaster declaration, and you're also asking outstate hospitals to start participating as the hospitals in the southeast part of the state are growing near capacity. We talked with some of ours here in our region in the Southwest. None of them say they have plans to do that yet, but tell me what those 2 things in concert, how those change an ever-changing picture with this virus.
Sure. Well, first of all, like a lot of governors, I have asked the president to declare Michigan disaster, and that is because that will make us make certain funds available to us as a state. This was a 26-page letter. A lot of work goes into this to articulate precisely what we anticipate our needs being. Now, I've learned from my fellow governors, Republican and Democratic alike across the country, that there are certain things we want to make sure are in this declaration. We're hopeful that we can get ramped up support from the federal government, because we know that COVID-19 is rising exponentially in our state, and it's really important. The other executive order that Rick mentioned was with regard to trying to balance some loads that our hospitals are confronting. I was at Spectrum earlier tonight, and I know how much planning and work has gone into making sure that this community, we're in Grand Rapids tonight, has the kind of resources that are going to be necessary. Right now in Wayne County and Oakland counties, we are growing so fast that it was mentioned in my call with all of the governors and the president and the vice president earlier today This is something that we all have to be mindful of as we create our surge plans and mitigate spread. And so what we've asked is that every hospital be ready for surge and chip in where they can. We don't want to move patients all over the state. That if anyone's drawing that conclusion from the order, that's not what's happening. But what we are trying to do is to make sure that we're able to meet the needs of people across the state. The more COVID-19 patients that are going to present in our hospitals in critical condition, the harder it is for any of us to be able to get the care that we need. And that's why, for all of our sake, staying home and mitigating spread is the most important, really the only tool we have right now, and we're asking everyone to do their part.
Governor, thank you very much. Doctor, I'm going to give you just a brief moment to weigh in on that, because as our medical expert, you know what the necessity will be, and you've seen firsthand what's happening in Southeast Michigan.
Yes, thank you, Rick. I really want to echo the comments of the governor. We know how the virus spreads. It spreads by close contact and by droplets. So this shelter in place is so important. If we look at where the most rapid rise of the COVID virus is happening, we're seeing it in New Orleans, we're seeing it in New York, and we're seeing it in Detroit. So really embracing this stay in place, it's incredibly important.
Thank you so much. Our goal tonight is to get as much accurate, reliable information about what the state is doing and what the medical realities are. And we want to get to your view. We want to get your phone calls, your video calls, your recorded messages. We'll be using all of that because the normal audience that we would have in the studio, just not possible for obvious reasons. This should be interesting. The questions were chosen based largely on the volume. Over 3,000 questions. The subjects that came up most often are the ones that we have tried to put into a question as we looked at your emails. Some will be more specific than others, and after the governor or the doctor answers such a question, I will attempt to broaden the topic to cover as many of your questions on that topic as possible. So the first topic tonight should not be surprising. It generated a lot of questions. Stay home, stay safe. So who should be staying home? Who can go to work? Our first question comes live right now from Kimberly. Kimberly Watt from Manton near Cadillac. Kimberly, what's your question for Governor Whitmer?
Hi, yeah. Good evening, Governor Whitmer. As we're all aware, there's a lot of difference in opinion as to what's considered a critical employee. My question to you is, under your executive order, are cash advance businesses considered critical to life? And if so, are those employers required to provide PPE, being that the 6-foot rule can't be complied with?
Kimberly, thank you so much for your question. I really appreciate it. I think that, you know, in this unprecedented time, we are taking unprecedented actions, and naturally there is a lot of questions and there is a lot of gray area, and we're hopeful that people are able to do the right thing and it's clear, but I appreciate you asking the question. Let me first start with this. COVID-19 is a novel virus. It is a virus for which we are finding is incredibly contagious, and it is deadly. It also takes a long time to realize that it has actually been spreading. It's been spreading in our state much longer than we're even aware. The fact of the matter is there's no cure for COVID-19 and there's no vaccine for COVID-19. And so right now the most important tool that we have is the ability to keep it from spreading. And the only way we can do that is by not spending time in close contact. Now, this stay-home order was aggressive. It's maybe one of the most aggressive in the nation. But I have been seeing what the modeling shows. And as we see this exponential rise, we know soon our healthcare system will be overcome. And that's why this was so important. So what the order says essentially is that unless you are in a life-sustaining business, you should be home. You shouldn't be working. Businesses know that they should be closed if they are not in a life-sustaining. We have exempted banks. We have exempted credit unions because it's really important that people are able to get access to their resources when they go out and buy food, when they go and pick up their prescriptions. These are the rare exceptions. And so a payday lender would technically probably fall into that, you know, those exemptions. But I would say this, anyone who is open and doing business really needs to make every effort to observe the CDC recommendations. So a payday lender should be having a big level of space between the person that is serving the customer and where the customer is standing. And we should never have customers, bunched up in a payday lender. We've seen in our grocery stores. I had a great conversation with the UFCW and Meijer this morning. They're putting X's on the ground so that people know how far they should be standing between one another. It's really important that responsible employers are protecting their employees and observing all of these CDC best practices.
All right, thank you for that question. Thanks for watching on Fox 33 up there. Thank you very much. Doctor, you wanted to weigh in quickly.
Yes, I just want to echo that same comment, which just goes to that, I had a chance to speak with the folks at Meijer, and one of the things that we have to remember that it's close contact and it's persistent contact. And one of the challenges we have is not having enough PPE, but if you remember, it's close contact and persistent, and as long as you tend to the things like washing your hands, coughing into your elbow, keeping that 6 feet distance, and staying home when you're ill, that really is the best protection for folks working in these essential roles.
Thank you both. A.J. Zink from Portage sent us our next question. This is on video. He asked about the seriousness, or the way people are taking it seriously, of the stay home, stay safe order.
So Michigan has followed suit along with Ohio, Illinois, New York, and California with the stay-in-place order. A lot of people are taking it very serious and others are not. What would be your words or your thoughts on the people that are not taking it serious? The second part of my question is between employers and employees. The businesses that are not essential are staying open and requiring their employees to come in. Is there going to be any type of words or any type of action that is going to be taken with these businesses?
You've already touched on part of that, Governor, but please.
I have, but I'm glad for the question because I know there's a lot of people that share that same inquiry. So, first and foremost, I've talked about how serious this situation is. We have hospitals that are at capacity right now, and we are just beginning our exponential rise. We've not hit the apex yet. Even though we've taken these aggressive actions to mitigate spread, we're going to continue to see numbers climb. It will be a week or two, or it may be more before we see the benefit of these aggressive actions. And that's why it's so important that everyone takes this seriously. There's not a generation in our population that is immune from this. We've seen a 1-month-old test positive for COVID-19 in Michigan. We've seen people in every generation lose the battle with COVID-19 already. 60 Michiganders have died. The more this spreads, the more people are going to die. The more people that are in our hospitals, the less likely it is for the person who has a heart attack that they're going to be able to get the care they need. Every one of us is impacted, and that's why it's so essential everyone takes this seriously. With regard to essential and non-essential, those life-sustaining activities are really important. Someone asked me, is a home builder, is that an essential service? If it is building a new home, no. If it is going into fix someone's roof because a branch came through the roof, yes. We have to use our common sense. But my message to business is this. The vast majority of businesses are doing the right thing by their employees and abiding by the order. And I thank them for doing that. But let's be clear, this is not a recommendation. This is an order. And businesses in Michigan are more often than not licensed by the state of Michigan. Anyone who plays fast and loose with this is really risking the possibility of serious fines, as well as, possibility of losing their licenses. I don't think anyone should be playing fast and loose and playing with the health of their employees. And so this is something that needs to be taken seriously by business people and individuals alike, because every one of us needs to play our part.
Governor, and finally, to put the final point on this, we got all kinds of questions about, can I ride my motorcycle with no destination? Can I get in the car and go watch the sunset? Even this one from Holt from, I think this is from Kimberly, I think. Yes, this is Kimberly watching on WLNS. She says, I have a friend who is moving to Iowa. Is now a good time to be moving out of state? I mean, this really all comes back to the common sense thing you've spoken.
Yeah, it's difficult. I think that the vast majority of people are motivated to do the right thing. I think a lot of people still are trying to get their arms around what COVID-19 means and why it's such a big threat to our economy, to our personal health, to the lives of people, of our loved ones. The more people move around, the more likely there is spread. And that's why we haven't said you have to just stay in your house and hunker down. You can get to the grocery store. We advise that you minimize those trips and you observe the 6-foot difference between you and other people and wash your hands and do all of these important mitigation activities that the CDC recommends. We recommend you get outside and you walk your dog. But jumping on a motorcycle and traveling is not permitted under this order. Getting out and driving around just to get out of the house is not permitted either. Walk, get some fresh air, but be smart. Observe this. It's not fun, but the fact of the matter is this is absolutely necessary. Our country has been through crises before. Our people have risen to the challenge. Here in Michigan, we were the arsenal of democracy during World War II. Everyone played their part. Right now, with a global pandemic, playing your part looks like staying home and not spreading this virus. And that's really the most important thing that we're asking Michiganders to do. For the person that is moving out of state, I know that Michigan's got the most aggressive mitigation laws in place. And so I hope that you think about that when you think about where you're moving.
All right, so we're going to move on. All of this is about staying home and staying safe, but there are a lot of different elements to that, and one of them, a major topic for thousands of families across the state, children and education. How to keep their minds sharp, that's one question for sure. But another, when will school resume? Joining us now live is Mackenzie. She's a 15-year-old from Gladstone in the UP. Mackenzie, what would you like to ask the governor?
Hi. As you know, states like Kansas and Virginia have made the decision to close their schools year-round. Is it a possibility that in the future Michigan will follow suit and close our schools for the rest of the year? And if this does happen, will we have to make up time for the time missed in the year?
So, Mackenzie, thank you for asking that question. It is the question I get in every interview that I do, whether it's on the radio or on Skype or here at the town hall. So I appreciate your concern. And at the age of 15, I know that you're worried about what does it mean for the rest of your year as well. I've got 2 daughters. They're both high schoolers. One is supposed to be graduating soon and the other's a junior in high school, and they're asking the same question. Here's what I know. This virus is growing so quickly in Michigan that the facts and best practices are literally changing by the day. We moved very swiftly to close school for 3 weeks initially. We were one of the first states to do it because I knew how important it was that we keep you and your teachers and your families safe, because you're going back and forth, and that movement around is what contributes to spread. As we continue to get closer to that initial date that I said, I anticipate making a decision and letting you know what it is. I am working with our educators, your teachers and administrators. I'm working with the state legislature as well as the Michigan Department of Education to make sure that we put together a plan that really ensures you get the education you need but protects your health. And so I would anticipate you'll know probably in the next week or so what the rest of your school year looks like and what our plan is to make sure that you're going to still get the education that you need regardless of what that decision is.
All right, Mackenzie, thank you for your question watching on WJMN tonight up in Marquette. Our next question about schools comes to us from Kelly Williams from Grand Rapids.
I'm the parent of a 6th and 9th grader who haven't been super geeked about doing their school enrichment homework. My daughters have been more into art, crafts, reading, and outdoor activities, and let's be real, screen time. I'm not a teacher. I have chronic health issues, so this has been a little tough on me. But their school has been focused on their mental and physical health, which I appreciate, but my kids are A students, and I have concerns about them falling behind. Teachers are assuring us that they will meet the kids where they are when they come back to school, but I'm wondering when that will happen and the way COVID-19 is spreading. And so I'm wondering if you have plans to extend the current school year into the summer.
So, Kelly, I appreciate your question. This is, the next obvious question to the Mackenzie's question. My kids are having too much screen time too, just so you know, we're in the same boat on that one. I want to make sure that our kids aren't forever behind because of this COVID-19. First and foremost, though, I want to make sure that they are healthy and that they are not exposed to this virus. This virus, as I've said, has hurt a lot of American kids. It spreads amongst all of us, but we've seen more American kids get hospitalized than any other nation. There are a lot of theories about why that is, and we're not going to go there now. But it truly is a risk for every one of us. And you said that you're medically compromised yourself, and so we want to make sure that it is safe for them to go back to school at the right time. But until then, what we're going to do is continue to work to ensure that your kids get the education and the support that they need so that they're not losing what they've gained this school year. So that whenever it is that they're back in, that they're prepared to take back up and to move on to the next grade. So these are all important components. Michigan has so many different districts with so many different assets and abilities because of just the difference in funding historically and resources. And so we've got to make sure we've got equitable solutions that ensures real education for all of our kids. And it's complicated, it takes time, but it is one of the most important things that we are working on right now.
Governor, you talked about your kids. My kids are learning from their teachers even though they're out of school. We've talked about if schools are going to be called off for the rest of the year. Will you go back in the summer? But what about that work that's being done? Kristen wants to know about the work that's being done, and she's live from Wyoming. Kristen, what's your question for the governor?
What is the plan to ensure our children receive the necessary education to prepare them for the next school year?
Yeah, so Kristen, Kelly, and Mackenzie all are asking questions in the same subject with the same concern. And that concern is, how do we make sure that our kids have the education that they deserve, that they need, that is a birthright? COVID-19 is a global pandemic. It's something that none of us could ever have imagined that we would be here confronting this. I know that all of us with kids are mindful of how important it is to reassure our children in this time of incredible uncertainty and stress. And I thank you for making that a priority. It's hard for parents who are wondering, worried about what's going to happen with our kids and what is this experience going to mean for them. As we formulate the plan for our kids' education, all of these considerations are driving it. I can tell you this. It is our intention to make sure that our kids are safe, that they get the education remaining of this year that they need so that when school starts back up, whenever that is, that they haven't lost a single step, and that seniors graduate on time as they were supposed to, and that our juniors are ready to rise and to take the SAT. But there are many components, from the third graders who need to be able to read to all of the standardized testing that we're not doing. And so we're taking each of these issues one by one and working through a real plan that is going to meet the needs of our kids. It's one of, aside from the critical health issues that we are confronting right now, that is one of the top issues that we are spending our energy on, and we're going to have a plan that meets our kids' needs, and you'll be able to understand it within the next couple of weeks.
Governor, one of the questions that I got every time I opened my folder with these 3,000 questions in there, and it surprised me a little bit, but we're going to go to the phone this time. This is a question from Flint. This is Shannon in Flint, and she's got a question to you. Shannon, go ahead. The governor's listening.
Thank you for taking my question. Will the filing deadline for Michigan income taxes be extended like it was for federal taxes? My accountant is considered non-essential. She's not in her office, and I'm concerned that they won't be done on time.
Okay, so Shannon, rest assured you're going to have an answer by tomorrow. I know that the federal government has extended the deadline. We're seriously looking at doing that for Michiganders as well for your state taxes, and it's an order that probably is coming down very soon.
And I would thank Shannon for a question. She's listening on WJRT, or watching, I should say, on WJRT. A lot of questions coming in about testing. Doctor, we're going to want to bring you in on this. Testing in our state, how much are we doing? How much can we do? What are their holdups? We know we don't have enough testing kits. What are the capacity numbers? Looking at our latest number, there are almost 2,900 confirmed cases, 60 deaths. So today, we got more numbers from the state. Nearly 12,000 tests have now been done. More than 9,000 have come back negative for COVID-19, 2,600 positive. That's lower than the total number of cases in our state because some of those tests were done out of state. So testing is a central component to this crisis. We want to join Marie now from Clawson. She's got the question for the governor. Go ahead, Marie.
Hello, Governor Whitmer. Thank you, and thank you to WIT TV for putting this together. My question is about the total number of coronavirus cases and the testing that's happened so far in the state. Currently, the state of Michigan is within the top 5 number of cases in the U.S. Do you believe that this is because we are testing more than other states? And if not, then what can you attribute this high number to? Thank you.
So I appreciate Marie's question, and I know that that's something that is vexing states across the nation. The fact is that we've not ever had as many tests as we really need to be conducting. We are now in a position where we have to prioritize who gets the test. That's not where anyone wants to be. In any ordinary sickness, if you have the flu, for instance, you go to the doctor. The doctor is there, they have the masks, the gloves. They use it one time, they throw it away. That's called PPE, that's the personal protection equipment. They give you a test, they write you a prescription. You know what you have a solution, you go home and everything's gonna be okay. With COVID-19 though, it is this novel virus. It is spreading so fast, it takes a while to present, often a couple of weeks before you even know it. And so it's been communicated from person to person because it's so contagious. It has incredible impacts, and you go, and the healthcare providers don't have all of the PPE that they need, much less the tests in order to determine whether or not you have the sickness. And so because of all of these fundamental needs that aren't being met, it really is a very serious situation. It's been growing faster than anyone even knew. Our ability to test everybody is it's not there. And our ability to treat everyone in the most safe way is compromised as well because we don't have all of the PPE. So one of the frustrations that governors across this country have is that we can't get the test from the federal government. That's really where they come from. And we're now finding more tests coming online, and I'm really pressing on FEMA as well as the Department of Homeland Security and HHS at the federal level to make Michigan a priority. On the call that I had with President Trump and Vice President Pence and the other governors across this country, they highlighted Michigan as a place where it's growing so quickly. Yes, we're doing more testing than we were 2 weeks ago, but no, we do not still have enough tests in order to do the robust kind of data collection that we should be. And so we're going to continue to see this number rise because it's been here for a while. It's been passed from person to person. The social distancing that I've ordered through the Stay Home, Stay Safe order, we won't see the benefits of that probably for 2 weeks. And that's why it's so important that people do it. In New York, Governor Cuomo had pointed to a few areas outside of New York City where social distancing has leveled off the number of people that are being detected with COVID-19. That's what we are shooting for. We've got to give our health systems a moment so that they can build out and meet the needs and get the PPE and build up our testing capacity. And that's why it's so important that every one of us does our part and stays home and really dramatically decreases the number of trips we're even making to the grocery store.
I want to take a moment to kind of give you an amalgamation of questions. We got so many questions, and Doctor, I'm going to go to you first on this. You can weigh in on what the governor just said too. People are concerned about our healthcare workers. They're concerned that they don't have enough PPEs. They're concerned that they're on the front lines. They've got to be out there every day. But do they have enough to protect themselves while trying to make us well? Doctor, give me your take on that, because that was one that came in a lot of different forms, but people are legitimately, and I say legitimately because there is a worry, worried about those healthcare workers.
Yes, it's such an important point, and some of the prioritization that the governor was talking about is going directly at this. As we look at what is one of the most important things, it's to make sure that our healthcare system stays intact so that it can respond to treating the patients with this virus. So what you see is this really amazing effort across communities, both to use traditional ways to acquire these sources to help people protect, like masks, like disinfectants, but then you see communities coming together to also help generate more of the protective devices as well as some of the disinfectants. What I would say is it truly is an all hands on deck where we want to make sure that we do provide. It also goes to an earlier question about how do we distribute these protective devices? And it's why this really personal responsibility in terms of hand washing, sneezing into your arms, 6 feet distance to keep you safe, and then that also allows us then to shift the PPE to either the people that are on the front lines in terms of taking care of patients with known coronavirus or suspected, as well as to help in the hospitals having the necessary testing that can be done to help determine how to take care of those patients. One really positive thing is what we do see, in addition to what the governor's been doing, which is to get federal tests, is really a number of the universities coming up and saying, can we also come up with ways to test that can help our health systems?
Doctor, thank you very much. Another really difficult situation, it's even difficult in good times, is childcare. Some parents are still working, and there are some people who are worried about finding childcare, and there are other people who are not sure if they ought to be participating in childcare, if they want to go to work. We have, this one I think was mailed into us, if I'm not sure. Yeah, I think this one is, this is Katie here. The question is, why are child care centers still allowed to operate without some kind of emergency license? I would really like to be home and quarantine with my family, but I must continue to work because parents and businesses are really stretching the definition of essential employment. We keep coming back to the same question, Governor. So now myself and my staff are putting ourselves and our families at risk. I'm tired of having to choose between my job and keeping my family safe.
I appreciate Katie's question. You know, the child care facilities should not be operating right now unless they are supporting families of essential employees and essential businesses. And so if that is not the case, then I think we need to know more information so that we can be informing the employer and keeping people safe. I want to add something though to the last question on PPE. On the way over here to Grand Rapids in the car, I was on the phone with nurses across the state of Michigan, and one of them shared with me that she used the same mask for the whole day, and then put it in a paper bag and left it at the door, and someone took it and disposed of it. These masks are designed for one use with one patient, and then they're supposed to be thrown away and then a new one put on. We are now in a position where our frontline professionals are wearing one PPE, personal protection equipment, for their whole day of treating people with COVID-19. This is a travesty, and this is precisely why when the federal government said you governors should go out and try to figure out how to find these things on your own, it was a sobering moment. We have been working incredibly hard to make sure that we are finding N95 masks. We found some in warehouses from employers here in Michigan who've been donated. We have contracted with companies outside of Michigan. We have 13 million on the way. I'm hoping that those shipments make it. We had some deals that the federal government commandeered, which was distressing to say the least. But we are working incredibly hard to make sure that these frontline heroes have got the PPE they need to treat people. And so anyone who's watching, you know, there are distilleries here on the west side of the state that are making hand sanitizer. There are our big three are all retooling so that they can start making some masks and face shields. If you happen to have any of these pieces of equipment somewhere in your facility, or you know someone who does that can help and drop them off at one of your local health systems, or contact the state through the State Emergency Operations Center, this needs to be all hands on deck, because 13 million N95 masks we're proud that we were able to secure those. Every state in the nation is competing against us for those, but they're still not going to be nearly enough. So we're asking that people consider, if there's something that you're able to help out with, that you get in touch with us, and you can go to the michigan.gov/coronavirus site for accurate real-time information, ways to connect, and ways to help.
One more quick question on child care. Our next question is from Ashley Hyatt. She's in Traverse City, and she's asking about help with daycare from a different standpoint.
Hi, Governor Whitmer. Thanks for taking our questions. I'm an in-home daycare provider, so I and many of my colleagues have been affected by the coronavirus. Many of us have tried to stay open, but not all of us have essential workers, or some of us have had to close due to family health concerns. I'm just wondering if there was going to be any support for us due to income loss from this, and where we might go to try to find that help that we might need.
Thanks for the question. You know, I'll just start with this. Each of these orders that I have signed over the course of the last 2 weeks has weighed heavily on me. These are tough decisions to be made, and I know that they've got economic consequences for our people, that educational consequences for our children. I know that when I pull kids out of school, that's, you know, 1.5 million kids that aren't getting the education that they need. Half of them qualify for free and reduced lunch, so that means meals that they're not going to get. I know that when we close bars, that there are people who get laid off, and businesses that are going to struggle to reopen when we get past this crisis. And I know that the stay-home order has got economic consequences as well. But I know this too. We are going to do everything we can to support people through this crisis. One of the orders that I signed expanded access to unemployment by 6 weeks. That's a month and a half of unemployment that didn't exist until I signed that order. It also gives us the ability to draw down more resources from the federal government so unemployed Michiganders get the same as people in other states. I signed protections against foreclosure, signed protections against eviction. We are taking every effort to make sure that people who are unemployed or underemployed will have the support that they need. Every decision that I've made has consequences, and as I said, they weigh heavily. But at the end of the day, I know the most important thing that I can do as your governor, my mission, is to protect the people of our state. And that's why these orders are so important, and that's why everyone is governed by this, and you must do your efforts, your best efforts to comply. I know this is stressful and difficult. I know that, and I'm asking you to do your part despite that, because we're all in this together.
Unemployment. We know that one of the obvious and unavoidable results of this stay-at-home, stay safe order was that we're going to be people that were going to be unexpectedly and immediately out of a job. And that is necessary, as you've pointed out throughout the first 40 minutes of this show, to try to keep the spread of this virus down. That means the unemployment system went to immediate hyperdrive, spiked by 2,100% at one point. That's created some concerns for folks. One of the biggest questions we've heard, how those out of work are going to access the unemployment system. Keely Blanchard is an attorney from Greenville. She's live on Skype tonight for us. Keely, go ahead with your question for the governor.
Governor Whitmer, I've been volunteering to try to help connect up our Montcalm County citizens to the resources that they need to survive. But one of the biggest challenges that I've encountered in trying to help people is that they've been unable to get through to the unemployment system, whether that be online or by phone, and they've struggled to get needed information from former employers who are now closed. What is the state doing to streamline this system so that people can get access immediately to desperately needed funds?
Thank you, Keely, for the question. I appreciate that you are volunteering to help people. I think that's amazing. I will say, even on the hardest days, there are sources of inspiration, and there have been some hard days, and we've lost a lot of people already, and we know that we're going to continue on that trajectory for a while. Thank you for being that source of inspiration for me today. You know, when it comes to unemployment insurance, we've had a system that has been overwhelmed by the number of people that are seeking assistance because they are unemployed now. A lot of state systems have gone down completely. Ours is up, but it has certainly struggled. We recognize that. And that's precisely why one of the executive orders that I executed loosens up some of the restrictions that used to be there when you would apply for unemployment. And so having all of the employer's information immediately during the application is not a requirement in this moment. We recognize the stress, the hard, the difficulty of getting these pieces of information. And so we've taken pains to lessen the restrictions and make it easier for people.
All right, we've already addressed this, but there's confusion. So I want to ask you about a big issue for people. Again, it has to do with the sacrifices that people are going to have to make during this spread of the coronavirus. Big issue, what to do about mortgages and rent payments. Is there any relief on that front? We know that there is, but I'm not sure people know exactly what it looks like. Our first question on the subject is a live phone call. This is Michelle Thornburg from Fenton, near Flint. Michelle, thanks, south of Flint, I should say. Thanks for joining us. What's your question for the governor?
Good evening, Governor Whitmer. I want to thank you for your prompt response and transparency through the last few weeks. My question relates to mortgage and eviction notices. I would like to know, has there been any discussions about following guidelines similar to New York?
Okay, well, thank you for the question. You're obviously someone that is well-versed in what is happening in New York and their guidelines. I am not, but I am going to be as a result of your question. I can tell you this, we have we've given protections for homeowners or renters that you can't get evicted during this COVID-19 crisis. So that is one of the orders that I signed. Also that you can't lose home to foreclosure if you do own your home. And so these are protections for people in their homes. I'm telling you to stay home. And I know that that means a loss of income for a lot of people. And we want you to stay home. And that's why these efforts to protect consumers in this tough time were so important. I will look into what they've done in New York that you referenced, and I'll ask my team to consider if that's something that we should be doing here in Michigan as well. And I thank you for raising it.
I want to take a moment and thank all of the people that sent in their questions, because for the most part, these were straight down the line questions. Mm-hmm. We know that politics gets injected in everything these days, but there were very few of those kind of questions. Mm-hmm. There were a couple involving the federal government, specifically President Trump. And some people are really concerned about President Trump's plan, and it changes from time to time, but he talked about opening large areas of the country back up before Easter. Ann Dunlop from Byron Center is live with us now with a question on that. Ann, go ahead, please.
Hi, Governor Whitmer. First, want to thank you for your decisive and proactive ideas that you've implemented to keep us safe. I'm concerned about the president's idea to reopen parts of the country by Easter. My question is, are you willing and able to continue to protect Michiganders by keeping things shut down as long as necessary, even if that is contrary to the president's wishes?
So, Ann, thank you so much for your question. I appreciate that, and a few things. First and foremost, I'll say this. You know, what we really as a country need right now is consistent, medically accurate information, and that's from anyone with a platform, frankly. What we also need is a national strategy. Having a patchwork of governors trying to navigate this is not really a great national strategy. Here in Michigan, I am choosing to be very aggressive. My friend Mike DeWine, who is a Republican governor in Ohio, has as well. My friend J.B. Pritzker, the Democrat in Illinois, has as well. There are governors who are on the same page and sharing information and trying to make these protections available to all, the people that we represent. But the fact of the matter is, there are big swaths of the country that are not doing any of these aggressive measures. And, I disagree with them, but that's on them until we have a national strategy. Ideally, that's where we would be headed. And I have made that known to the president, that I think that would be a good strategy. I'm going to continue to make decisions based on the best science, what epidemiologists are telling me, what Dr. Jonay Caldoun, our chief medical executive, is telling me, what the doctor here is sharing as well. Here's what I know. The inconsistent messaging coming from people with platforms is creating a lot of consternation, anxiety, and is undermining the aggressive actions that we really need to be taking. This is part of the reason that I think so many people are still congregating and not taking this seriously. This is a moment in our story that is incredibly serious. And I am not going to make decisions based on anything other than what's in the best science and in the best health of the people of our state. And that's always going to come first for me. You can count on it.
Governor, thank you. That dovetails nicely into the second question, and it popped up frequently. I wouldn't have expected it, but it was there often enough that I felt like I would ask it, and it's something you addressed today to some degree. Okay. And this is one that is an email. It's from Ron Postma, and it summed up what many wrote on this subject. It says, Governor Whitmer, I appreciate all you're doing to get us through this crisis. I believe you're doing your best, and I believe you are sincere in your efforts. I believe also that government at all levels are doing their best and sincere in their efforts. My question is, why do you feel in every talk where you share information with the public, you have to take, his words, quote, a dig or criticism at the White House? It dampens all that you just said, just brings in politics when this is a time that is best to leave politics out.
Yeah, so Ron, you know what? I agree with the spirit of your question. I don't agree with the characterization that I take gratuitous digs. I don't. I do talk about part of what is contributing to the crisis that we have, and that is under preparation and a lack of a national strategy. That is a problem, and I stand by that. And it's not gratuitous to point that out. I'll also mention that it is important that everyone understands the magnitude of this problem, and that is one piece of information. That another is the lack of PPE. Another is the fact that this is a virus that is aggressive and is novel and has no cure and no vaccine. Another is that we are Americans and we are used to our freedom and independence, and we like to congregate with who we want to congregate when we want to. All of these are factors that is making it more and more difficult for us to contain the spread and making this more and more dangerous for people in our state. And so to the extent that you felt that was gratuitous, I am sorry that is how you felt about it. But it is an important part of why this is so serious for us to take, why we've got to do the preparation, why we have to make decisions based on science and what we're seeing play out around the world. We need to learn lessons from this, not about placing blame, but to understand, how did we get here? How serious is this? And what is it going to take to protect people?
Governor, I appreciate your response, and I want to talk about something that we haven't gotten to yet, and Doctor, I want you to weigh in on this too. We know that this is a serious physical health issue. We know a lot of the things that we need to do, and we have been talking about them. Both of you have talked about them extensively here. What we have not yet touched on is the mental toll that this circumstance takes. And I can tell you, the people that were writing in questions, you could tell some of them didn't really care if their question got on the air. They just wanted to talk to somebody. They wanted to be able to express their concerns and what's going on. And we know that if you go back, in fact, one of our viewers wrote in, I believe this is Parker Richards from Hudsonville. He writes this: during the 2008 recession, statistics clearly showed suicide rates, depression increase. How do you plan to combat these kind of deaths due to an economic slowdown, which we are no doubt going to see? Money is one of the #1 stresses in today's country, and you add that with this pandemic. Doctor, I'll go to you first because it's the whole picture, right?
Yeah, thank you, Rick. It's, you know, we do think about physical health, but the mental health is so important. You know, we haven't seen something like this in many of our lifetimes, and the idea that it causes stress, it causes anxiety, it causes fear, and that can then lead to, you know, this incredible sense of, you know, feeling lost and anxious. And so it's so important to do some things that are shown to help here. It's to make sure that, you know, you're getting the right nutrition. It's to reach out and ask for help from family and friends. It's to do your best to maintain some of those connections and to take time out. It's also important to recognize that there is a large number of people in our society who at baseline are struggling with depression and struggling with anxiety, and this comes in on top of that. So a few things would just be, again, 1, let's look out for each other. 2, seek out resources that are out there that can give you a break or help, you know, engage with the rest of the world. And like Extension is one example. MSU Extension is in every county, and they have a website you can go to. And then the third is, if you do need help, reach out to a mental health provider to get that support you need, and don't hesitate to make that outreach, because these are extraordinarily stressful times.
Governor, I'm going to move to what I believe will be our final question, and it ties in with this very same thing. I know I'm getting ahead of ourselves here, but this is something I know you're already thinking about. This question is from Luke from Saginaw, and here's the issue that he would like to know about. What will you do to make sure that the Michigan economy is strong? I don't know, did Luke actually send this in? Let's have him ask you.
My name is Luke, and I was wondering what you were going to do to make sure that the Michigan economy stays strong and well after the virus passes.
Well, I appreciate that question, Luke, and he is a young Michigander who is thinking about the future, and I think that that's really important and inspiring. You know, here's what I know. Each of the decisions that I've made has an economic impact, and it makes them very difficult to make. But at the end of the day, if we don't take this on, this aggressive virus on with aggressive measures, it will extend the length of time that we are confronting it. That more people will die because of it, more people will get sick, our healthcare system will have even greater stress than we already know it's going to, and that this will trickle on and undermine our economy longer term. And that's why taking aggressive action now is actually the best economic decision we can make. It is hard. I don't mean to minimize the concern and the stress that people are feeling. To the contrary, I feel it. I understand it. And that's why we've taken all these other steps to try to mitigate the impact of it. But the fact of the matter is, for you, for the future of our state, we have to take these actions now so that one day when we can start to turn things back on, we are healthy, we are stable, we have saved lives, and we are in a position to do it with the best science and medical counsel as possible. What we have seen around the world is nations that move too quickly before they've really gotten a handle on COVID-19 get another spike. That would be even more devastating. To have this go on too long or to have a spike would be horrible for our state economy on top of the health of our people. And so all of these are factors that drive every decision we make. We're going to continue to put the health of Michigan people first, and that's always going to be in the best interest of our economy.
Dr. Governor, thank you so much for answering all of these questions. Thanks for all of our viewers who have sent in those questions. Governor, I'm going to give you a quick final note here.
Okay. Well, I really appreciate all of you tuning in. You know, we know that tough times don't last, but tough people do. We have been here in a crisis before, where the country needs its countrymen and countrywomen to pitch in, to collectively rise to the occasion. Michigan once was the arsenal of democracy to win World War II. We need that same spirit now. For many, your contribution will be staying at home. For others, it might be staying at home and going online to make a donation to your food bank, or calling 211 to see how you can help, how you can safely help someone. Or maybe it's retrofitting your machinery to make sanitizer or gowns or face shields for our first responders. To get through this, we must all do our part. Stay home, stay safe, save lives.
Governor, thank you very much. And I want to take just our final seconds here to talk a little bit about how this came about. I want to say a special thanks to the governor's team, particularly Tiffany and Bobby, who worked with us on this to make sure that we could bring together your voices to interact with the governor, knowing that the governor, none of us, can safely go out and do it face to face. It worked extremely well, thanks to our great production department here, Brandon Lacey, who worked tirelessly to produce this thing out today. We really put this together in about 48 hours, and with the cooperation of the governor's team and with the team here at Wood TV and all of our partners around the state, WLNS, WJRT, Fox 33, and WJMN, we were able to, and the folks at clickondetroit.com, we were able to blanket the state with this information, vital information that you are going to need on an ongoing basis. The one thing I would note is that there's a lot of information out there, but when you get it from the doctor and the governor, you're getting the best, freshest information that we can possibly get to you. So remember, when you get a source of information, make sure it's the right information. And finally, here's a note. I have 2 young sons, and we occasionally watch movies, and they are almost always animated, as you might guess. But all those animated movies normally have a moral. Over the weekend, we watched one of those movies, and the moral of the story was, be ready to do the next right thing. Michigan, I would invite you to be ready to do the next right thing. From Grand Rapids, for the doctor and the governor, thank you for watching. Good night.